I called a friend of mine who's been in the post-acute business for a long time, knows everybody. And I said, listen, I want to run through the top 10 home health and hospice companies, and I just want you to kind of give me a read on each one. He said, before you start, let me call one out. And I said, well, which one do you want to call out? He said, let me call out Compassus. And I said, well, what do you want me to know about them? And he says, those are the true believers. He says, they internalize the quality message. So for me, as a leader, not losing that mission-oriented culture, mission, vision, and values. At the time when I joined, say, a $700 million company, now we're passing the $1.5 billion mark. How do you preserve that culture, right? What I'm bragging about is I think we're doing it.
Once you left Fresenius, what surprised you the most when you entered the home-based care community? What was the big differences?
When you think about integrated home-based care to include palliative and hospice and home health and infusion and maybe PCS also, there's nobody has commanded more than 3% market share. And that fragmentation, I think that was surprising, but it also is opportunity.
People have become computer operators versus nurses, and we have to get rid of the computer operation and let them go back to thinking and taking care of patients. We have to get better, faster, quicker, or we're going to continue to burn out these clinicians. What legacy do you want people to remember Mike as when it's time for you to move on and finally retire for the last time?
I want to see Compassus be a meaningfully scaled organization. So we have a voice in what that patient journey looks like. I want to be recognized by our health system partners as that specialized managed service organization to help them get to the next level. And I want to be able to lead in the narrative. The story that we have to tell in palliative and hospice and home health and private duty and infusion is a powerful one.